Now take a look at this. This is a scene. You can either interpret this as a smiley face or as the vultures about to land. And that is the dichotomy in the way people react to a public plan. They don't say, well, tell me what you're talking about. I mean, describe the public plan. They hear a public plan, and the polarizing response has already begun. If there will be a public plan, and we are not committed one way or the other, we in fact said to the Senate, we thought, frankly, that that was not the best way to get to affordable health insurance for all, but we're not in Washington making the decisions. If there will be a public plan, this is the way the AMA will weigh in on it. Participation by physicians should be voluntary. Now, initially, you may know that it started out in the House that there was going to be mandated physician participation. We went ballistic. We said, look, you have 97% of physicians in the country belong to Medicare as participating physicians. You never mandated it. Why are you trying to fix a problem that ain't broken? If you want to mandate this, you're going to blow up Medicare. So don't do this. Don't do something that is going to so offend physicians' ability to make choices of their own, thoughtful choices, that you'll get a reaction that you really don't need. And so it was changed so that it is no longer mandated. Patients, we think, should have a choice, not just either going bankrupt or taking just the choice that their employer offers. But those are the things that are being discussed in Congress, and it does come down to the legislation, and we'll see. We do believe that if there is to be a public option, it must be a level playing field with private plans, because frankly, we want the private plans to succeed. We want them to treat us better. We want them to partner with us in trying to make lives better for patients and making it easier for doctors to take care of patients, but we don't want them to be out of business. And we think that if there is to be a public option, it needs to be fiscally responsible. Okay, here's the emergency room, and up in the top, the docs are saying, is this swine flu? And the other one says, nah, this is sore throats from screaming about health care reform. That was what happened in August, and the rhetoric went from the death panels to some of the really bizarre things that you heard from people in Congress who not only should know better, but knew full well better and said this anyway because of partisan politics. Really very disappointing. And you've already heard an allusion to this one. This is the guy saying, what this country doesn't need is government-run health care. And the doc says, yeah, well, okay. You want me to send you the bill, or do you want me to send it to Medicare? But you've already heard from Bob why people think that. But this is one I want to show you. This is a cartoonist from the Buffalo News. You see the folks who are insured. We don't need reform. Our coverage is fine. But under the bed are the hidden costs that are making the premiums unaffordable, both for employers and for their employees. The president at the AMA said, and this got a big standing ovation, I recognize it will be hard to undertake reform if doctors feel like they're constantly looking over their shoulder for fear of lawsuits. The president has put his money where his mouth is. He can't control Congress, as you may have noticed. But what he did do is he authorized his administration, because we have said you have got to do something about liability reform. And we can count votes just like all the rest of you can count votes. But we as doctors need some relief on tort reform. So the administration, outside of the role of Congress, has announced $25 million in grants for states to experiment with things like early offer, restitution, corrective action, not health courts. That wasn't listed there, but we believe that that will be allowed as well. It is anemic, but it is a start. It's better than we had before this was announced. And we will continue to push, because there isn't a doctor in this country who doesn't know that defensive medicine is real and that frivolous lawsuits change you forever as a doctor. Right?
Yep.
Yep. Here are the responses, the only picture of myself I threw in here. This is just to show you that the leadership of the AMA, after the president's speech to Congress, said we are very worried about health costs, we're worried about defensive medicine, and it is a moral imperative to get health care reform passed, meaningful health care reform. Well, I'm going to quickly go through this because things are all changing, but in the House, here's what's happened. You had all the committees. There are still amendments being discussed. There will be a separate bill on a single-payer alternative. It is not expected to pass, but it will come up, and someday they'll get to a conference. The Senate Finance Committee has an exchange, a national exchange. It did not include a public option as most people interpret it. There was an individual mandate and there were subsidies for low-income individuals. The insurance market reforms are critical. No denial for pre-existing conditions. The Senate bill did not repeal the SGR. There was a Band-Aid and a small update next year. That was not good enough, and that's why we were so hopeful, and we'll get to that in a minute, that didn't go well yesterday. The Senator Kennedy's committee bill was approved. The Finance Committee bill was approved. Those will be melded into one, and ultimately we will get a Senate bill, a House bill. We'll get to conference committee. And now let's go very quickly. See, I sent these slides in a couple days ago, and so we're going to really go quickly through 1776 because it went down in flames yesterday, and there will be hell to pay, I will tell you. What was the advantage of 1776 introduced by Debbie Stabenow? It permanently repealed the SGR formula, permanently repealed it, poured concrete into that hole, and walked away from it. And that's what physicians need, so that we can go forward in a different payment methodology, which we've already laid out ways to help pilot with the government. Now, it didn't pass. It failed miserably, 47 to 53. And that is a very serious problem for us, but it is not the end of this story, because for physicians to continually be in the situation of having to do the annual death dance with Congress to stop the programmed cuts that make no sense based on a flawed formula, it has got to simply be repealed. Well, take a look at the numbers in the third bullet here. If they had passed this in 2005, the cost would have been $49 billion. The next year, $127 billion. The year after that, $178 billion. The cost this year, as you know, was $245 billion. By not passing it, what do you think it's going to be next year? And where do you think the money's going to come from next year? I mean, the idea was to exclude this, to acknowledge the reality, as has been the case for the last 7 years, that the cuts are not going to go in. And let's just be honest about it and say they're not, and we'll start over. But they couldn't do that, and they couldn't do it because of the concerns about the fiscal sustainability. We believe that the president wants to sign has yet to be written. We believe that there are good people in Congress on both sides of the aisle. We believe they should lay down their partisan arms and come together around what this nation needs. It is a moral stain on our nation that we have not figured out how to insure all Americans. It must be done. Putting it off is not smart. We believe that they will scale back. We believe that negotiations will go through December. We do think that the president will sign a bill before the elections of next year. And just to remind you, whatever one's inclinations, the current occupants of the executive branch are going to be there another 3 years. The AMA promises that we are committed to improving the quality of care, we are committed to ensuring all Americans, and we are committed to being partners with many folks who are not physicians. That includes government, that includes health insurers, and it absolutely includes patients.